Hari Om. I hereby welcome all of you for this course of Yoga Therapy Training course. And I am definitely very happy that you want to learn something of yoga therapy and you want to help also afterwards for the different persons with different diseases to get relief with the help of yoga. But to start with, I want to mention one very important aspect, that yoga is not a therapy. You will definitely surprised to note. Yes, but it is a fact. Yoga is a very ancient science, as you already know. It has been formulated as a science by the great Rishi Patanjali 2500 years ago. Since then, yoga is being practiced in India, outside India, and now throughout the world. When yoga has been designed by Patanjali, he has mentioned the ultimate aim of yoga, which is not a therapy. Rather, he doesn't mention anything about yoga therapy in his text. He says yoga is to control chitta vritti, yogaha chitta vritti nirodha. And further, to develop the human being up to the level of great Almighty. So in modern terminology, we can say the individual consciousness to be evolved up to the level of universal consciousness. Definitely a total evolution, total development. To generalize this development, on the primary level, we can say yoga is a science of total personality development, which is a base of the evolution for the soul. But it's okay, we are experiencing the result also. These regular yogic practices, we can develop our personality on physical level, mental level, emotional level, intellectual level, and spiritual level also. But nowhere in the text Patanjali has indicated that it is a therapy. But when we can say it is a development on physical level, definitely the health is expected. And the diseases is a disturbed health. If one wants to develop, we want to overcome the disturbances. So indirectly we can say we have to get rid of different diseases and then only we can evolve. So definitely yogic practices are designed in such a way that they will help a yoga practitioner to overcome the diseases, to attain a health, and then develop the health. There's a logic behind that, and that is why many of the yogic practices are useful for overcoming different health problems. And so, we can use it as therapy. So we can say this is a therapeutic aspect of yoga. But as it is not designed as therapy, just as Ayurveda, it's a therapy, Indian system of medicine, but which provides all the information for the student which is needed to use as therapy. But as yoga is not designed as therapy, yoga has not provided all those information which is needed to use as therapy. So definitely something is not there If you think as a therapy, something is not there. But anyway, some yogic practices we definitely can use to overcome the physical problems, mental problems, of course with certain limits. So we'll try to understand how these techniques are used. Of course, that is depending on our experience. Because yoga therapy also is not constituted or formulated and standardized. Every yoga experts, they try using all these different practices for different diseased persons and they get good results. So everybody's experience may be different. So there is no particular standardization for this. It may take place maybe after few years or many years, I can't say. Anyway, just let us start studying the science of yoga from this viewpoint. You know, the science of yoga is designed 2500 years ago. Or even it was there previous to that also. In India, we get so many references which go back to maybe about 7500 years ago also. But definitely there is no reference of yoga therapy during all these periods. Hatha Yoga, that has come out maybe after 1000 years from Patanjali's time. But Hatha Yoga also not mentioning particularly yoga as therapy. Then how this word itself has come in practice? The credit goes to Swami Kuvalayananda. He was a great yogi in a recent period. He has established one organization which is quite famous. It's a Kaivalya Dham on the Pune-Mumbai road. The institute is still functioning quite well in the field of yoga. So he has established this institute in 1924, just a recent period. And of course, he has designed the institute for the research in yoga. He wants to prove the different results of yogic practices with the help of modern machines and with the help of principles of modern science. He has started doing a lot of experiments. So one of the experiments he has done, that was on the asthma patients. That experiment was continued maybe for 3 months. So the asthma patients were treated with different practices of yoga, particularly cleansing practices, asanas, pranayamas. And after the course is over, he got the miraculous results that there are a lot of development in most of the patients. Most of the patients have stopped taking medicines, inhalers, and so all these treatments, they are cured to good extent. I think this is the first experiment of yoga therapy carried out by Kuvalayananda. And then of course it continued in Kaivalyadham also, in other institutes also, because he has explained all those things in his magazine of Yoga Mimamsa, and the experiment reached to the different corners of the world also. So we can say that that is a start of yoga therapy. So yoga therapy has started maybe 80 years back. But during these 80 years, it has become more popular because that was the need of time. We can refer particularly the Hatha Yogic text, because Patanjali mentions only one word, that is Vyadhi, that is disease. Whole of his sutras, there is only one word which is connected with disease. And he says Vyadhi and the disease is a obstacle in the path of journey of yoga. And to overcome that obstacle, he has suggested the way of chanting of Om. And that's all. But Hatha Yogic text, they explain number of asanas, pranayamas, cleansing processes, and in detail. So we can practice accordingly. We are practicing according to that only. So in that process, Hatha Yoga has explained the result of particular asana, particular pranayam, particular cleansing process as a effective technique for particular diseases. So there is some connection between the different practices and different diseases. So we can say that yes, there is some reference. But this reference is just for certain practice connected with certain disease. Definitely not as a therapy. There is one chapter on treatment of problems in Hatha Yoga. That is the 5th chapter. It indicates the treatment for some results of pranayamas, but the results are not good. If something pranayama is practiced in some wrong way, there are some wrong results. On such results, Hatha Yoga explains another certain type of pranayama. And whole this thing is explained in one chapter. That is the 5th chapter of Hatha Pradipika. So I think these are the references in ancient yogic text which are connected to some diseases and the effect of yoga on certain diseases and all that. But considering all these, the different yoga experts and of course many yoga institutes, they started some experiments on these diseases, and nowadays yogic practices are used widely for the different patients. I would like to mention our own history about this topic. You see, we have established our institution in 1960. An institution was designed for yoga training. So we were giving yoga training on different levels. And definitely we were giving the training for healthy people and not the patients. We were insisting that patients are not admitted in yoga classes. So you are getting the forms filled as usual. No? So I mentioned whether you are suffering with some physical problems. So people are writing some problems in that column. And those who are writing some problems, we don't admit them in the class. So they were not admitted. Some of them were really interested to practice yoga, but they have got some problems. So they would not get admission if they write that problem in the form. Now, some of the patients, they filled up the form and they have written nothing in that column. They say, we don't have any problem. So we admitted them. And they learn all yogic practices. And after completing the course, they have reported us that they are suffering with some problems even though they have not written in the form. But now that problem is cured, and it was a surprise to us. Because we were not admitting patients, because we are treating all regular yoga practices. And when the patients come to class, they are cured with the same thing. Definitely surprising for us and a stimulation for us to think of the yoga as therapy. So definitely we thought of it, we studied so many things and came to conclusion, yes, we can try some of the yogic practices for some of the diseases to get relief. Let us see what is the result. So in that way we have started therapy in 1985. It means 25 years from our establishment, we were not admitting the patients in the class and we were treating only healthy people. But from 1985 we are declared, yes, of course we are giving the separate training for those people depending on their diseases. So then the diseased people, they started coming to our institution. We started to studying their disease and all other things, and then we have to teach which is suitable to them and definitely avoid which is not suitable to them. And we started getting the good results out of that. So we started with OPD, outpatient department. Students were coming with certain physical problems for certain period, maybe 1 hour or 2 hours. 2-hour center. We are treating them, we are teaching them different practices. And they are going home for the remaining period. But because of this popularity of this treatment, the people, maybe the patients outside the city, they also wanted to get yogic treatment. And for them we have to start the indoor hospital, rather we can say. We can call it as a yoga hospital. And yes, they started yoga hospitals. Now we have got 2 centers in our city. One is 30 bed, one is 50 bed. The regular patients are admitted. We, after proper checking, we decide what to teach. That was a very crucial and important job, of course, critical job, to decide what to teach and what not to teach. And then we continue, and we are getting a very good results. Normally we admit the patient for 10 days. And our normal observation is that we get about 60 to 70% relief within the 10 days. It's quite good. Of course, then we teach everything to them and then we give them in writing that you continue at home. The patients, those who continue at home, they get 100% relief. It's good, no doubt, but it has got certain limits also. It is not that we can treat each and every patient. There may be many diseases, many levels of the patient, and so many things are there that we are going to learn now, step by step. So, to understand this difference, and of course the limitations, and of course the possibilities of using yogic practices for different patients, we'll just compare with other therapies. Because as I told you, yoga is a very recent therapy. Maybe 80 years back. The other three is modern medicine is there, and Ayurveda is there, homeopathy is there, and so many pathies are there which are being used, and of course every pathy has got definitely good results. So compared with the other pathies, what is the standard and what is the footing of yoga? Let us discuss something about this. Of course, this is based on my individual experience, which we experience in our centers, maybe indoor center, outdoor center. Because we have treated more than 33,000 patients. So definitely good experience is there. So I am all talking with you with the base of this experience only. You see, first I can tell you that yoga is the best treatment where there is no alternative. That is, it is best out of all pathies in many respects. Of course, for certain diseases, disease may be just like slip disc, psychosomatic disorders, and diseases with unknown cause or unknown diseases. Diseases there, but nobody knows what is the problem. Even you can test all these modern tests, X-ray, MRI, CT scan, whatnot, brain scan, everything. Still there is nothing wrong, but the patient is suffering with something. This I call it unknown disease. And of course the unknown cause. But for such problems, I thought that yes, we are getting very good results. Presently you don't understand all these diseases because this we will discuss afterwards, one by one. I may repeat these things again, what we are doing in our center for these diseases. But there is no alternative, that's what I also experience. So I can say yoga is the most easy solution for these problems without any complications and without any side effects. So it's very good for us. But in certain cases, yogic practices can be used as a parallel treatment with other therapies. Heart disease, or even diabetes, asthma and all that. Because these diseases, they have got some severe attacks to the patients. And their values are high. Blood pressure is high, blood sugar is very high. Some heart complications are there. So in that case, so modern treatment is definitely required, which can give immediate result. Maybe temporary, but immediate result. For a diabetes person, sugar level is very high. Immediately you should take some medicine and bring the sugar level to normal, where yoga is not useful. With any yoga practice, sugar level is not coming down immediately. So that is a limitation. And as I told in the beginning only, there are some limitations are there because yoga is not a therapy. So we have to administer different medicines, different treatments in addition to yoga. Rather we can say yoga is a parallel. The person can practice asana, pranayama, meditation, as well as he can take some medicines simultaneously. Because medicine will have the immediate effect. Yoga will take long time to get the effect. To start with, both things continue. And as he continues the practice of yoga, he is getting the results of yoga. After some time, slowly medicine can be tapered down. So here we can say yoga is practicing as a parallel with other therapies in certain diseases, in certain patients. In some situations, some cases, yoga is definitely not an important therapy, yoga is not a parallel therapy, but yoga is a supporting therapy. Mostly the acute conditions of most of the diseases. If a person is getting heart attack, so we have to shift him to the hospital, intensive care unit, and give the proper treatment. If you start teaching asana pranayama, he has got a heart attack, then very difficult for him to survive. It's definitely true. Yoga doesn't have emergency treatment. So you have to take to the hospital, do whatever the doctors prescribe and do it. Then he will stabilize to some extent, maybe in the IC unit, but he stabilizes. Then we can add some yoga nidra, om chanting, something like that. So yoga nidra, om chanting is not a main treatment, major treatment. It's a supporting, just supplementary. So there are many cases where we have to utilize yogic practices as just supplementary. The major treatment is maybe other therapy. And to go a little further, I would like to say that there are some diseases where there is no treatment in the science of yoga. It's quite possible because yoga is not a therapy. That is our answer, which I have given in the very beginning only. And for example, accidents, wounds, fractures, what yogic practices can do in such cases? Nothing. Just a regular treatment in the hospital is necessary for such patients. Even I can say HIV, AIDS, cancer, juvenile diabetes. These cases also, yogic practices don't give proper results. Of course, for cancer or other diseases, after the regular treatment, you can provide rehabilitation program. That may not be direct treatment, but rehabilitation program is very good with the help of yogic practices. HIV AIDS, yes, we are trying on the HIV patients. What is the effect of yoga? Some researches are also going on. We also carried out some researches. We found out, yes, some result is there, some better result is there. Particularly HIV patient, CD4 count goes down. And that indicates a loss of immunity. That is a major problem with HIV AIDS patients. So with the regular practice of yoga, their CD4 count increases. That we have found out on the machine itself. But still, we have not reduced the medicines, because reducing the medicine is a very dangerous situation for HIV patient. Till now, there is no other solution than to continue the medicine. So we got some result, but not definite result, which will help us to reduce the medicine and finally may stop the medicine. So we can say he is cured with HIV/AIDS. So these things are under experiments. So like this, there are different levels on which the yogic practices can work, can provide. So when we want to give the solution to the different patients, we have to consider all these points. And that is why we must note all these points with very carefully things. Where there is no use of yogic practices, it's not worthwhile teaching them yoga and spending some of their time. Let them go for better treatment than yoga. But where yoga is essential, definitely we can tell with confidence that without other treatment or even without surgery, you go for yoga practices and you can get a good relief. So all these levels we can experience. That's what we have also experienced for many of the patients. And now we have got quite good judgment. When a patient comes to our hospital, this is our first and very important decision, whether to admit the patient and treat with yogic practices or reject it. Yes, there are some cases for which we have to reject the case. We have to tell them that there is no use of yogic practice for you. Either you may not be able to do it or you may not be able to get the results. So it's better go for modern medicine treatment. There you can get some solution. Now we'll come to the point of the total process for teaching patient. So let us see this diagram is indicating now. You see, left side, you got a patient, person with some diseases. So he has got some symptoms. Symptoms, he has got feeling something, maybe some temperature is there, some headache is there, numbness is there. Something is wrong. Something is abnormal, what he is facing. And he wants to get rid of that. So that is called all symptoms. So patients are there with the symptoms. Then the therapist has to diagnose. So diagnostic system is a very important stage in this process. Diagnostic means finding out what is wrong in his body. Symptoms, what the patient is experiencing. So he will explain, these are the things happening with me. But now why this is happening? That is to be found out. What is wrong in the body? Suppose a patient says, I got a headache. So headache is a symptom. The headache may be because of acidity. Headache may be because of indigestion. Headache may be because of some nerves problem. Headache may be because of low sugar, because of high sugar, because of high blood pressure. There are a number of reasons are there. So patient doesn't know why headache is there. That is the duty of a therapist or a doctor, we can say. So to find out that, so that is called diagnostic system. So modern medicine has developed number of tests, laboratory tests, X-rays, MRIs, testing of blood sugar, you know very well. So number of tests are there. They are good, no doubt. They exactly indicate what is wrong in the body. So we can come to the root cause of that disease. So finding out that root cause is a diagnosis. So yoga is not a therapy, so there is no diagnostic system in yoga. You see, Ayurveda is a therapy definitely. So Ayurveda has got some diagnostic system. Maybe sensing of pulse, observing the patient. There so many are there. We need not go in detail. Modern medicine has got different laboratory tests and scan and sonography and so many things. Homeopathy also has got certain diagnosis system. Number of questions are asked to the patient, and from the answers of the patient, the therapist has to come to certain conclusion about diagnosis. But yoga, there is no provision. But we need to diagnose the patient. Diagnosis is essential. Without that, treatment is not possible. So we have to decide what is the root cause, what is the problem, what is operating in the body. Then only we can treat. So definitely we have to rely on the diagnostic system of other therapies. And the best one is, of course, definitely the modern science, modern medicine. Very good tests are there, all laboratory tests are there, the machines are there, so you can get the perfect results. But there is a large variety of tests. So we must know what is the test and what is required for which parameter of the body. So first we have to estimate what could be the problem, with which organ the problem is there, and then accordingly we can recommend a test. But to our experience, when patient comes to the yoga center, he is not directly coming to yoga. Normally he is approaching to different pathies, different doctors. He might have carried out many tests. He has got all test reports ready with him. So he has got a big file. Normally these people, they come to yoga because they are not satisfied with other treatment. They are not getting proper results. So they'd say, yes, we'll try with yoga, what happens. So we have got most of the tests ready. Test means report of the test ready with the patient. So we can go through that. So at least we must be able to read what is the interpretation of the test. X-ray is there, MRI is there. If MRI is there, you can say MRI, but if are able to diagnose from the MRI, that knowledge has to be gained. That is more important. And in certain cases, we feel that we need to carry out some additional test also, so we can recommend to the patient also. But these different tests are definitely essential for diagnostic. So there is no system in yoga for diagnostic. So we have to rely on modern medicine in particular. So when it is decided what is the problem, what is the root cause, what is the diseased organ, then there is a treatment for the particular thing. Of course, in different pathies, different treatments are there. There are medicines, maybe chemicals or herbal medicines in Ayurveda, or homeopathic medicines in different way, macro medicines in homeopathy and so on. So medicines are there. The modern medicine, modern science prescribes surgeries. Very fantastic development has been taken in surgery. So many things can be done. Corrected, replaced, or planted also new things. So much development in surgery. Surgery also a good treatment. Then some diet is prescribed. Normally diet is prescribed in most of all the therapies. And change lifestyle, that is also a new pattern which has come out. So all these things are there. And if you consider yoga, we have different asanas, pranayamas, cleansing processes, meditations, om chanting, yoga nidra, and also so many things. So this under comes on this all treatment. So we have to decide what to teach. So this is a third stage. And then the cure starts. When the patient takes medicines or surgery, whatever it is, or even yoga practices, then the cure starts. That means the symptoms are reduced step by step. After some time, the symptoms totally disappear. And the cure is there. And finally, the person attains a good health. So this is a total process of any therapy. Patient with symptoms, with all these processes, finally he reaches to the good health. That is the aim of therapy. That we have to improve the condition of patients. So he attains a good health. So when we learn and study different yogic practices, we will also have to follow these stages and processes. And definitely we have to attain the final target of good health. It means we don't have to teach yogic practices. Students are coming to us to learn yogic practices. Most of them are healthy, so no problem. But these patients, they are not interested in learning yogic practices. They are interested in getting the good result, good health. That is the basic difference between the student and patients. So teaching student is a totally different thing. Treating patient is also a totally different thing. So one has to master the techniques. Most of you have become yoga teacher. So you know how to teach yoga. That is a good thing, no doubt. But for this diseased people, you must know what to teach. That is a basic thing. You can't teach all the practices to all the persons. Because every yogic practice is good, no doubt. As a student, it is very good, it is helpful, everything. We know, you know very well. But if you consider a diseased person, definitely some yogic practices are good and some yogic practices are bad. If you teach the wrong yogic practices, the practice is good, you will teach also in a better way, but the practice is not good for the patient, then it will increase more complications. There is no relief. So we have to avoid that. That is why teaching a patient is a very difficult job. a little serious also, we can say. We must think of seriously, because we are dealing with a person. He came to us with very hope to get relief from his problem, and if you teach something which is increasing his problem, it's very troublesome. Troublesome by law also, troublesome by ethics also. So definitely you need to study well, get good experience, and then try properly. That is what we'll also try to teach. Now, considering all this, I want to put some important point for the yoga, that yoga is best. I told you for certain cases yoga is not good. Yes, that is there, but those percentage is very less. If you consider, say, 100 patients, general patients of different diseases, maybe there are 5% patients where we cannot treat with yoga, but 95% patients we can treat, and we can give the good results for those patients. So definitely it's good, and 5% also we are not treating them wrongly, we are just refusing them. They will approach to some other therapist and may get relief. We may not bother about that, but 95% patient definitely we can give a good relief with the practice of yoga. So I can say yoga is best for psychosomatic disorders. Psycho is mind, somatic is body. So psychosomatic disease is, of course, disease is physical, body disease, but the cause is in the mind. Something is wrong in the mind and it reflects on the body. So body is diseased. See, hypertension, high blood pressure. Actually, the blood pressure is high, it's a physical parameter. But cause is tension, and that is psychological parameter. Something is wrong in the mind, so the tension is there, stress is there, and that is why the blood pressure is increased. So this is psychosomatic disease. Disease is physical, cause is mental. Likewise, there are many diseases. Rather, nowadays, the doctors came to the conclusion that every disease is partly psychosomatic. And if for every disease, there is certain cause in the mind. And the medicines can treat body, because they are all chemicals. They work on the body. So they can treat body functions, but they cannot treat mind functions. There is no medicine for treating the mind. You may say, oh, psychiatric medicines are there. Yes, but psychiatric medicines are just sedative, suppressive, or tranquilizers. They are not improving the mental condition. They are just suppressing or sedative, that's all. So there is no medicine for improvement of the function of mind. And that is why all these psychosomatic diseases, the medicine is to be continued throughout the life. Whether it may be hypertension, it may be diabetes, it may be asthma, it may be even arthritis, or so many diseases, practically all diseases. But yoga is designed for controlling the functions of mind. Yogaha chitta vritti nirodha. You know that. So basically, yoga is designed to control the functions of mind. So definitely, yogic practices will have certain effect on functioning of mind. So they will improve the function of mind, which is required for every psychosomatic disease. So in that way, I can say yoga is best for psychosomatic disorders, where we can stop all the medicines and a person will be perfectly healthy, which otherwise is not possible in other therapy. Second point is yoga is best for prevention. There is no preventive medicine. Suppose if you have got a hereditary problem of diabetes. So as per the modern theory, you are supposed to come across diabetes maybe at the age of 35, 40, 45. And you want to prevent it. by knowing all these things, maybe at the age of 30. But there is no medicine. Nobody will give medicine for preventing diabetes. You will be told that yes, let your diabetes should start, then we will give the medicine and then we will control the sugar. But yes, yoga can give preventive medicine. That is preventive treatment. You continue the practice of yoga, you will never come across diabetes, even if it is hereditary for you. There are many examples in our institute. We are teaching yoga since last 55 years. So there are many people, they were diabetes by hereditary, but diabetes has not started. So they started practicing yoga. Now also they are continuing the practice of yoga and they are not suffered with diabetes at all. Now they are maybe 60, 70 years of old. So definitely we can give good treatment as a prevention for many of the diseases, which is not possible in many of the therapies. Then yoga is best for rehabilitation. A certain treatment is there, maybe certain surgery is there, some serious operation is there, something is there, and now the patient is come to normal. But there are, because of many side effects of different treatments, the patient has got some drawbacks, setbacks. There is no disease, but he is not coming perfectly normal. So to bring his health to perfectly to normal is called rehabilitation. And yoga is very good process for rehabilitation. So carry out some serious treatment if required and then continue yoga. Definitely you will be perfectly all right. So yoga is the best process for rehabilitation. As most of the medicines have got bad side effects. Any medicine you refer on internet and you will find there are a number of side effects are there. They are already declared and it can't be avoided. To overcome the side effects, again some medicines are prescribed. Those medicines have got still more side effects and the chain continues. That is what is happening with modern medicine. Even though some medicines are useful, they are creating some bad complications also. And the patient has to suffer. We can say for yoga, no side effect. Rather, I can say in a better way that yoga has got a side effect, but which is positive, which is good. Suppose a person with cervical spondylitis, something wrong with the neck, is coming to our center, we teach him different asanas and all that, and he is okay. His cervical spondylitis is cured. And what is the side effect? Because of regular yoga practice, his digestion is improved, his blood circulation is improved, his joints are improved. So he is very happy. His mental condition is improved. He gets a mental peace, gets a good sleep. So these are the side effects of yoga. These are the positive side effects, good side effects of yoga. So there is no negative or bad side effect of yoga, provided you are selected properly. If you select some wrong yogic practice, then definitely wrong side effect will be there. But if you select properly, there is no bad side effect. Side effect is always good. So there are definitely some plus points, some minus points. And the cause is, I told you already, it is not a therapy. It is not designed as a therapy. So some points may be there, but if you consider plus points, there are many plus points are there. But some important points for yoga treatment. The patient has to do the required practices himself or herself. He cannot assign somebody to do the yoga practice and get the result. So in such case, we can say the patient must be able to do all that. That is also an important point. If the physical condition of a person is not suitable to do all these practices, then he cannot do it. He will not get results. He has to make some different arrangements. And person has to spend some time. results are not immediate. Medicinal results may be immediate. If blood pressure is high, you take one tablet, blood pressure will come to normal within an hour or so. But that is not the case with yoga. Yogic results will take definitely some time. That may vary from person to person, but not immediate. But these results are permanent. Medicinal results are immediate but temporary. So you have to prepare. But medicinal has got the side effect also. Immediately good effect, but long-term side effect. Yoga has no bad side effect, but it takes some time. So these are the factors which you must know, and you must make the patients aware about this also. Then the practices are required to be done correctly and regularly. That is very, very important. Doing correctly, yes. If the practices are done wrongly, definitely the wrong result is there. It's obvious. And correctly, in a sense, correctly for a particular person. As every person has got different level of health. So that correctness may vary from person to person also. So by considering the patient, you have to decide what is correct level. And to that level only you should teach. And he must practice it regularly. Just learning the yogic practice will have no effect. Suppose for a particular disease, you have got 10 asanas, maybe 2 pranayamas, 1 cleansing practices. You teach maybe 5, 6, 10 days. And that's all. If patient doesn't continue with that, there is no result. So he has to spend time daily and continue the practice. And then definitely he will get the results. And result will be a permanent result, not temporary as medicines. And of course, the controlling the diet. I have not talked anything about diet, but basically food intake is very, very closely related to our physical condition of the body. Because food is the only thing which we take from the external world. Of course, air is there, but basically food and air, these are the things we take from the external world inside the body, and which we must match with the functioning of the body. So these two are different aspects, but particularly food aspect is important for the disease, because for certain diseases, certain food is good, certain food is not good. Actually, food is good, but not good for a certain person, certain disease. Then we must avoid that. If you don't avoid that, he continues with that, and you continue with the yoga treatment, still there will be no result. For example, the person suffering with the cough and cold, he should avoid all milk and milk product. Actually, milk and milk products are good, but it is not good for the person who is suffering with cough and cold. So he should avoid totally, and then we can teach yogic practices. Then he will get the results. But if he doesn't avoid it, he continue to take it, and you continue to teach him yoga, there will be no result. He has selected properly, teaching properly, he is doing also properly, but he is not following food restrictions. He will not get the proper results. So in one way, we have to learn to some extent dietetics also. Different types of food, different qualities of food. What is the result for different patients? Definitely we have to prescribe accordingly. Now, in short, I have to mention some limitations of yoga therapy. I mentioned some of them, but I am just to enumerate, because that is also very important point is to be noted. Because when these limitations are there, we have to understand these limitations and follow, be within that limitation. Don't try to overcome. There will be no success if you overcome the limitations. As I told you, there is no diagnostic system. So we have to rely for a diagnostic system on modern medicine only. That is well established nowadays. So we have to learn all these things. What are the different tests? What are the results? What are the normal results? What is the abnormal result? And all that thing we must learn to some extent. So we must interpret the reports from the laboratories and testing departments. Then only we will be able to know the actual condition of the patient. There is no emergency treatment in yoga. If this emergency arises, straightway we have to take the patient to the hospital and let the doctors do their own treatment. In yoga, we have no asana pranayama emergency treatment. Rather, we should not waste our time in doing some yogic treatment for emergency. If somebody has a heart attack, somebody there is an accident, somebody has become unconscious, something like that. So these are all the emergencies. So emergency we cannot handle and we should not handle with the help of yogic practice. That we must remember always. There is no surgical treatment. Where actual surgery is needed, it has to be done, that's all. There is no substitute treatment for any surgery. Of course, in very certain and critical cases, which we know by our experience, we can undertake to some extent. But as a general rule, I tell that there is no surgical treatment. So where surgical treatment is recommended and essential, let it continue. If you spend some time, just a trial error method of teaching some yogasana and pranayama and all that, it may be at the risk of the patient's life also. So it's better to go for surgery if surgery is prescribed. There are no medicines in any form. We will not give any medicine. We are not authorized to give, and there is no medicine explained in yoga. Yoga, we have got asana, pranayam, cleansing process, meditation, yoga nidra, om chanting, mantras. These are our medicines. No physical medicine is there. So don't try to give any physical medicine as a yoga therapy. There is no treatment for severe illnesses. At this point we'll discuss different diseases hereafter. At that time I will explain that this is a severe condition where yoga is of no use. That severe condition may be for an ordinary disease or maybe for the diabetic also. If the diabetic person entering in coma is a serious condition, severe condition, there is no yoga treatment. The person suffering with arthritis, all joints are locked together, he cannot make any movement. This is a serious condition. So likewise, for every disease, certain serious conditions are there where we cannot give any yoga treatment, we cannot teach any yoga practice. So that we must know properly. And of course, no treatment for severe stage of certain disease. Some severity is there. Let the hospitals take care of it. They have got all equipments, machinery, experts, everybody is there. So everything is there which we don't have at our center. So definitely we should not spend or waste the time. Let the patient go to the hospital immediately. So that will definitely save all the complications for him. So this is how all about just the introduction I have given. I have not talked anything in detail, please note. It's just the introduction about what yogic practices can do for the patients. The details we'll study one by one, step by step in different lectures. So, Hari Om.